There have been hundreds of confirmed and suspected cases of dengue fever in Barbados. In the spotlight this week is Dr. Leslie Rollock, Senior Medical Officer of Health. She'll talk to us about dengue fever and what's now being called severe dengue.
Dengue fever is transmitted in Barbados mostly by the Aedes aegypti mosquito, which is a daytime mostly mosquito, usually early morning, late evening, but it can bite anytime during the day. And in other countries, and less frequently here in Barbados, by something called Aedes albopictus, but the Aedes mosquitoes. The Aedes aegypti mosquito, everybody should know what that looks like by now. It is relatively big and it has black and white stripes. And it's only the female mosquito that transmits dengue.
According to the World Health Organization, there are an estimated 100 to 400 million dengue infections each year. Referred to as dengue, there are 4 serotypes or strains of dengue fever. You might have heard the term dengue hemorrhagic fever before. It was thought that this could be one strain of the dengue virus, but it has been found that each strain of the dengue virus can produce mild to deadly complications in humans. The WHO has reclassified the dengue categories.
Based on what is being seen across the world, the stages of dengue, they've switched from dengue fever, dengue shock syndrome, dengue hemorrhagic fever, to dengue fever, dengue with warning signs, and then severe dengue, which may include a hemorrhagic component. Dengue fever in humans is caused by one of 4 viruses. There are called dengue types 1, type 2, type 3, type 4. There are ideas that type 2 may be more virulent than the others, but actually the severity of illness is not dependent for most persons on this strain. Getting infected with one type, we believe right now that once you recover, you will not get that type again, and it gives you partial. You may have produced antibodies that give you some protection from the other strains. However, it is usually the second infection with the second type, whichever the second type is, that you're more likely to get severe disease with that. So it's not necessarily that one type will give you severe disease and the next one won't, but is the succeeding infections with the strains are more likely, you're more likely then to get severe disease. Since the early part of 2020, the strain that was discovered was type 3. In previous years, we've had type 2, we've had type 4, we've had type 1. Up to about 2016, we had type 3 as well.
Dengue fever affects infants, young children, and adults. And while the illness rarely causes death, it's important to know the symptoms of dengue fever as well as the warning signs of severe dengue in the event things take a turn for the worse.
The thing about dengue is that you can be infected and be asymptomatic. So the majority of people may be asymptomatic, and when they recognize that they have dengue, it might be the second time that they have dengue. And that would be when they're exposed to a new strain. Dengue infection is indistinguishable, but if it is symptomatic, it tends to turn up like a fever, high fever, body pains, headache, especially pain behind the eyes, and then pain on movement of the eyes, joint pains, nausea. Some persons may have vomiting. You may get rash, and the skin rash tends to be, it could be all over the body, it could be just over the joints, a red bumps, right? But most people experience what we would call flu-like symptoms. It's like body pain and fever, but without the cough and the respiratory symptoms. You can get nausea, which is just upset stomach. You can get vomiting, and you can get diarrhea over 2 to 7 days, and then the fever goes down and you gradually get better. In a very small subset who may go on to have severe disease, there are certain things we call warning signs. When the fever starts to go down, then the person feels worse. They get abdominal pain. If they have vomiting, the vomiting gets worse. And then they may notice that the gums are bleeding, and those are signs to go to your doctor and for your doctor to take note of for admission, because the warning signs may predict severe disease, but even though a person may get severe disease, they may not die if they are managed through that period, which is like 24 to 48 hours where they have to get drips and so on, which must be done in a hospital.
It appears that severe dengue affects children more than it does adults, but no matter the age of the individual, if the warning signs present, it's extremely important to get to a hospital or to a doctor for urgent medical care to avoid further deterioration or even death.
Children, whatever the strain, are more likely to have severe disease. We're not quite sure why, but we've noticed that in all the outbreaks that have all over the region since 2018, the first time they've noticed that something was happening is because children presented with severe disease. So between 5 to 14, that tends to be the age group that is severely impacted. Older persons may get severe dengue as well, but in most of the outbreaks that have been having in this region of the world, the Americas, and it's been happening since 2018, 2019, children are more likely to get severe disease, but they don't necessarily die. Something else has to happen. Severe dengue is not curable. You can get the person through it by ensuring they get supportive care early. And as I was saying, after the fever starts to go down and persons present with the warning signs of then severe abdominal pain, the appetite does not return, they start to get bleeding, they may get evidence that fluid is collecting in other areas of their body. Those are the signs of severe dengue that persons need to be managed through 24 to 48 hours usually, and then they recover. If they are not managed through it, then there's a likelihood of organ failure. So they get liver failure, kidney failure, heart failure, and those failures tend to cause the death.
From time to time, there have been appeals for blood donations for individuals hospitalized with severe dengue.
In severe dengue, the platelets, the things that help the body to clot, goes down, so that persons tend to bleed. So one of the first things you may see is actually bleeding from your gums when you're brushing your teeth and you don't have gum disease, or you have been known to have nosebleeds in the past and now suddenly is gushing. Or for female, may be having a period and then it is heavier than usual, along with infection. Is not just a heavy period. So because there is a risk of excessive bleeding because of the effects on the blood, blood constituents in this body's reaction to this viral illness, the person may need platelets, especially the clotting factors. But the most common thing is that there is what we call plasma leakage. The capillaries that normally keeps the blood in the blood vessels, they're leaky. So persons have fluid in their liver, they have fluid in their lungs, they have fluid around the heart and so on. As I said, that's usually a temporary period that you have to ensure that their blood pressure stays up during that time. But they're being monitored so that when the leakage starts to correct itself, they're not then overloaded with fluids. So that's something that usually has to be done in a hospital.
For persons who suspect that they may have dengue fever or have been diagnosed with this mosquito-borne illness, there are some medications which they must avoid taking. This is just as important as knowing the warning signs of severe dengue.
What you should do is take anti-fever medication, which we recommend because of the risk of bleeding with severe dengue, not be aspirin or any of those what we call non-steroidal anti-inflammatory. So no Brufen, no Advil, no aspirin, no Whiz, just paracetamol, Panadol, or acetaminophen, which is what the Americans call paracetamol.
To confirm that someone has dengue fever, blood must be drawn from that individual within the first 5 days of infection and a test conducted on that blood sample.
So a lot of persons have been going to the doctor has been sending away the Panadols and saying, I think you have dengue. They have not done any tests. So we get a lot of suspected dengue, but the only way we can be sure that it is dengue is if they take some blood and we can do some tests on it. To be able to determine what type it is, we need to do a blood test on the person, actually do a molecular test, which is a DNA test or RNA test on the virus itself at the Best of Santos lab to determine that it is dengue, firstly, and not chikungunya or another mosquito-borne illness, and then to determine the type. So that is done by molecular diagnosis, what we call real-time PCR testing, which can be done here at the Best of Santos laboratory. So in some offices, doctors do something called a serological test looking for antibodies to dengue. And if it's a particular type of antibody, they can say, well, this is something recent, a recent infection with dengue. It doesn't tell you the type, so they can say, well, you have dengue. But a lot of persons just go on clinical, right? So even if a person has a serological test for dengue in somebody's office, we can't tell the type, and we will not. And based on the current conventions, we can't say that is a case. To say it is a case, we need the molecular testing to be able to say, yes, this is a dengue case. So when we're reporting, you will notice that we say X number of suspected cases, X number of confirmed cases. The only confirmed cases are the ones that have been determined by the PCR test.
According to research, you can't get infected with each type of dengue virus more than once. So essentially, a person can only get dengue fever 4 times.
As far as we know right now, you will get dengue type 1 or whatever strain is circulating. If that's the only strain that is circulating, you will not get dengue type 1 again as long as your immunity remains. Like you don't get a disease, chemotherapy from cancer, or you don't get immunocompromised for some other reason that gets rid of your antibodies that will protect you against getting that strain again. Those type 1's antibodies give you partial immunity to type 2, type 3, and type 4. But unfortunately, they also increase your risk of getting severe disease because they're not a perfect match for the virus strain. So they activate your body's defenses.
The dengue virus is transported around the world by infected travelers. If the Aedes aegypti mosquito or another vulnerable vector bites an infected person, then there is a possibility that the dengue virus will be transmitted to someone.
Once the person is bitten and the dengue is in the mosquito, the saliva of the mosquito, then anywhere from 4 to 10 days after, somebody may develop symptoms. If they're going to be symptomatic, they may develop symptoms. So a person with dengue fever, ideally, while they're infectious, which is within 2 days before they develop symptoms, and then say for the time that they're febrile, they should really be sleeping under a mosquito net. If there's dengue in the country, to protect yourself from being infected, you also can prevent yourself from being bitten. Mosquitoes are strong flyers. They like it hot. So to a certain extent, being in a cool place, air conditioning can slow down the activity of mosquitoes. You wear insect repellent on your skin, exposed skin, because sometimes I see people just putting it on their arms and legs, but a mosquito can bite you on your forehead or your neck or your ear. So on exposed skin, and an insect repellent that contains DEET, DEET. To prevent the mosquitoes from getting into your house, it is helpful if you have screens on your windows and doors that they cannot come in. And if you see live mosquitoes in your house, you spray them. You try to ensure that they do not bite you.
So to recap, there are 4 strains of the dengue virus, and each can produce mild to severe symptoms, including death. Early diagnosis and medical intervention are key to survival. Thanks for watching. I'm Shamkoe Pilé, and this has been In the Spotlight.